So first, the introduction of joint. What is a joint? Joint is a junction between two or more bones or cartilages. It is a device to permit the movement. Here you can see the knee joint. Joint is occurring between the lower end of femur and the upper end of tibia. Okay. So it is a joint is a junction between two or more bones. Here also another bone is taking part, that is patella. Patella is also taking part in knee joint. So there may be two bones like the shoulder joint, scapula and humerus was articulating, only two bones are taking part. But knee joint is a complex type of joint, so here more than two bones are taking part. Or joint cartilages are also present. There are meniscus, C-shaped cartilages are present in this knee joint. So that's why it is a complex type of joint, and joint is a device to permit movement. So movement occurs in all the joints of our body. That is the main function of the joint. And with the exception of the hyoid bone, every bone in the body is connected to or forms a joint. So it is a one exception, very important for your Viva or MCQ. Okay, which bone in our body does not take part in any joint? Hyoid bone. Hyoid bone is lying in our neck. Okay, at the junction of floor of the mouth and front of the neck. Here is the position of hyoid bone. Only muscle and ligamentous attachment is there, but it does not articulate with any other bone in our body, hyoid bone. So there are 230 joints in our body, total number. Now what are the functions of the joint? It holds the skeletal bones together and it allows the skeleton some flexibility so the gross movement can occur and make the bone growth possible. Bone growth occurs at the two ends of the bone where the joints are lying. So that is also a function of the joint. Now we will classify the joints. Joints are classified into structural and functional classification. So structural classification is determined by how the bones connect to each other, while the functional classification is determined by degree of movement between the articulating bones. Okay. So first we will discuss the structural classification of the joint. This is very important. Very frequently asked in your bones Viva table and also important for your theory questions. Okay. So according to structural classification of joints are of three types. Fibrous joints, these are fixed joint. Cartilaginous joint, these are slightly movable. And synovial joint, these are freely movable joints. So these are the three types of joints: fibrous joint, cartilaginous joint and synovial joints. Now we will divide these joints in another divisions. So fibrous joints are mainly of three types: sutures, gomphoses and syndesmosis. And these sutures are again of these five types. Sutures are plain sutures, squamous sutures, serrate sutures, dentate sutures and syndesmosis. Now we will divide the cartilaginous joints. Cartilaginous joints are again of two types: primary cartilaginous joints and secondary cartilaginous joints. Primary cartilaginous joints are known as synchondrosis. Secondary cartilaginous joint is symphysis. Okay. Then our synovial joint, third type is the synovial joint. This chart is very important to remember very carefully, this chart. Okay. So synovial joint is freely movable joint. These are of 7 types of synovial joints are present in our body. Plain type of synovial joint, hinge type of synovial joint, pivot type of joint, bicondylar joint, ellipsoid, saddle and ball and socket. Tomorrow we have got two types of joint, ball and socket type of joint, shoulder joint, and another we have got plain type of synovial joint. Okay, plain was acromioclavicular joint was plain type of synovial joint. So now we will discuss the individual joints in details. Okay. So first the fibrous joint. Fibrous joint bones are joined by fibrous tissue or dense connective tissue and consisting mainly of collagen fibers. And the fibrous joints are further divided into three types. First is sutures. Okay. Sutures or synostosis. See, these are the cranial bones. Sutures mainly occurs among the cranial bones or flat bones. So, and these are the suture lines. These white lines are the suture lines, and the end of the bones are connected by dense fibrous connective tissue. Okay. So, sutures or synostosis, they are found between the bones of the skull, and in fetal skulls, the sutures are wide to allow slight movement during the birth, and they later become rigid, forming the synarthroidal type of joints. Okay. See, these are the different types of suture. There are 5 types mainly. So, here is the plain suture. The ends of the bone taking part in sutures are plain. Okay. And there is a in-between membrane that is known as sutural ligament. In between the two ends of the bone, this is sutural ligament. Now here, so example of this plain suture is median palatine suture. Okay, two palatine bones have two horizontal plates. Two horizontal plates articulates with each other and forming this median palatine suture, forming our hard palate. Now we go to the serrate suture. Here you can see the ends of the bones are serrated. Okay, it is present in interparietal suture, in between the two parietal wave bones of our head. Now there is squamous suture. See, the ends of the bones are beveled. That means they are pointed on one side, and another side there is blunt portion, and they are corresponding to each other. Plane is corresponding to each other. So this is squamous suture, and it is lying between the temporal bone and parietal bone. Parietal bone is here and temporal bone is in the ear region. So here is this joint is located. Squamous type of suture. Now there is denticulate suture. Okay, denticulate suture, you can see the bone ends are like tooth. It is resembling like a tooth. This type of suture occurs in lambdoid suture. Lambdoid suture is located on the posterior aspect between the two parietal bone and occipital bone posteriorly. So this is the location of 5 sutures, and you have seen the pictures of all the 5 sutures. Now other type of fibrous joint is syndesmosis. Syndesmosis occurs between two bones. Two rough surfaces are connected by fibrous tissue. See, this is the lower end of tibia and fibula. They are inferior tibiofibular joint. That is one example of syndesmosis. Okay, and all the interosseous membranes connecting the bones, like interosseous membrane is present in our upper arm by in between the radius and ulna, and in our leg in between the tibia and fibula. That are also example of this syndesmosis. One interosseous membrane will be connecting the two interosseous borders of the two bones. Okay. Another is gomphosis. Gomphosis, also known as peg and socket type of joint. Gomphosis occurs in our teeth. Okay. So this is socket of the teeth, and this is the tooth, and it is articulating, and the fibrous tissue is connecting the two structures. So this is gomphosis, peg and socket. Gomphosis is only present in our tooth. So the two main bones, maxilla two maxilla and mandibles are taking part in gomphosis along with the tooth. Now there is synovial. It is a type of wedge and groove suture. Okay, it occurs between the ala of the vomer and rostrum of the sphenoid. This joint is present in our nasal septum. Okay, nasal septum. These two bones are taking part in formation of the nasal septum. Vomer is a perpendicular bone and dividing into two ala, and in between the two ala articulating these projecting structures from the inferior surface of the sphenoid bone, that is known as rostrum of the sphenoid bone. So this is example of the synovial. So we have seen all the different types of fibrous joint. So synovial are joints where the two adjacent bones are joined together by a greater amount of connective tissue than in sutures and in the form of interosseous ligaments and membranes. So we have discussed inferior tibiofibular joint and middle tibiofibular joint connected by interosseous membrane. Both are example of the synovial. Okay, interosseous radioulnar joint, interosseous tibiofibular joint, example of synovial. Now go to the gomphosis. Gomphosis is a specialized fibrous joint restricted to fixation of teeth in the alveolar socket. See, this is the alveolar socket. Here is the tooth connected by this fibrous strands. So this is gomphosis. It is a specialized fibrous joint restricted to fixation of the teeth in the alveolar sockets of the maxilla or mandible, and the root of the tooth is attached to the socket within alveolus by the periodontal ligament. See this orange color structure, this is the periodontal ligament. Now, so we have covered the fibrous joint, all its types and its examples and its pictures. You write down the names, examples, and also practice some schematic diagrams. Okay, for theory, you always prepare schematic diagram. Diagrams are very important in anatomy. Almost 50% marks are lying in diagram. Okay, so are there no need to draw an artistic diagram? Practice schematic diagram. Schematic diagram is very important. Okay. So we go to the cartilaginous joints. In this type of joint, the bones are joined by cartilage. Two types of cartilaginous joints are present: primary cartilaginous joints and secondary cartilaginous joints. So first we go to primary cartilaginous joints. These are known as synarthrosis, and bones forming the joints are connected by a plate of hyaline cartilage, and these joints are immovable and mostly temporary in nature, and this cartilage may ossify with the age. Examples in human are the joints between the first rib and the manubrium of the sternum. See here, this is sternum, manubrium and body of the sternum. So this first rib and manubrium of the sternum, this first costochondral junction is the primary type of cartilaginous joint, and joint between the epiphysis and diaphysis of a long bone. Okay, long bone develops from two centers, primary and secondary center. So middle part of a long bone is known as diaphysis, and at the two ends develops the epiphysis. A junction between the epiphysis and diaphysis, primary cartilaginous joints are present. Okay, understood? So you have understood the example of primary cartilaginous joints. Next we go to the secondary cartilaginous joints. It is known as symphysis. In these joints, the articular surfaces of bone forming the joints are covered by thin plate of hyaline cartilage, which are connected by disc of fibrocartilage. Okay. Example are symphysis pubis, intervertebral disc. See here, intervertebral disc has been shown here in between the vertebral bodies. One intervertebral disc is present. Manubriosternal joint between the manubrium and body of the sternum, and symphysis menti. Symphysis menti is present in between the two halves of the mandible, and symphysis pubis it is between the pubic bones in our hip, near our hip region. Okay. So these are the examples of the secondary cartilaginous joints. So we have covered the cartilaginous joints. So you can see that these secondary cartilaginous joints are mainly lying in the midline of our body. Okay. See this manubriosternal joint or this intervertebral joints, symphysis menti, symphysis pubis, all these are located in our midline of our body. So remember it. So secondary cartilaginous joints are mainly midline joints. Now we go to the synovial joints. Synovial joint is very important. Comes as a long question in your theory paper. Okay, discuss the synovial joint. Like this, we will read the structure of the joint tomorrow. Today we will discuss shortly the different types of the synovial joint. Okay. So these synovial joints, these joints possess a cavity, and the articular ends of the bones forming the joint are enclosed in a fibrous capsule. As a result, they are separated by a narrow cavity, and the articular cavity which is filled with a fluid called the synovial fluid. See, these two bones are articulating, and the ends of the bone is covered by a articular hyaline cartilage, and there is a synovial membrane, and it is forming a cavity, and this cavity is filled with a clear fluid that is known as synovial fluid. So all these are features of a synovial joint. In fibrous joint, the two ends of bones are connected with fibrous tissue, but here synovial cavity and synovial fluid are present. What are the characteristic features? Articular surfaces are covered by a thin plate of hyaline cartilage, and the joint cavity is enveloped by an articular capsule which consists of outer fibrous capsule and inner synovial membrane. See, this is the capsule of the synovial joint. So this is outer fibrous capsule and inner synovial membrane. Synovial membrane is lining whole of the joint cavity, and the cavity is filled with synovial fluid secreted by the synovial membrane, which provides nutrition to the articular cartilages. Here are the articular cartilages at the two ends of the bone, and helps in lubrication of the articular surfaces. So helps in the free movement of the joint. Some joint cavity completely or incompletely divided by the articular disc or menisci. These are present in knee joint. Okay, and menisci. Two menisci are present, medial and lateral menisci. And these menisci are present in the middle portion, and they will divide the joint cavity into further divisions. So these are the different types of synovial joint: plain joint, hinge joint, pivot joint, condylar joint, ellipsoid joint, saddle joint, and ball and socket type of joint. So plain joint articular surfaces are more or less flat, okay, and they permit gliding movements in various directions. Examples are the intercarpal joint, intertarsal joints between articular processes of the adjacent vertebra. Here, these are the carpal bones of the hand. In between the carpal bones, the joints are the plain joint. Okay. Also, the acromioclavicular we have learnt yesterday, that is plain type of synovial joint. Next, we go to the hinge joint. Hinge joint, the articular surfaces are pulley-shaped. See here. This is a pulley-shaped articular surface. At the lower end of humerus, pulley-like structure is present, that is known as trochlea. Okay, this trochlea articulates with this trochlear notch of this ulna to form the elbow joint. So this is one example of hinge joint. So the articular surface are fully separate, and this type of joint permits movement in one plane. Okay. So this is elbow joint. Only we can flex and extend at this elbow joint. So this movement consists of flexion and extension, and these joints have strong collateral ligament to prevent other movements. On the two sides there are collateral ligament, medial and lateral collateral ligament. We will discuss during joint classes. So to prevent other movements, two examples are the elbow joint, knee joint, interphalangeal joint and ankle joint. Okay, these are the examples of this hinge joint. Next we go to the pivot joint. The articular surfaces of one bone is rounded and feeds into the concavity of the another bone. See, this is occurring between radius and ulna. Okay, head of the radius is rounded, periphery is rounded, and it articulates with the radial notch of the ulna at the upper end of the ulna here. Radius and ulna articulating like this. This is one example of pivot joint. So articular surface of one bone is rounded and feeds into the concavity of another bone, and further rounded part is surrounded by one ligamentous ring. At the two ends of this concavity, one ligament is attached, that is known as annular ligament, okay, which keeps the head of the radius in position. And in children, there is a high risk of pulled elbow. Pulled elbow means the head of the radius coming out from the ring formed by the annular ligament and this socket. So movement is limited to the rotation around a central axis. So around this vertical axis only rotation occurs in pivot joints. Example of this type of joint are the joint between the proximal end of radius and ulna. Another is atlanto-occipital joint. Atlanto-occipital joint occurs between first two cervical vertebra, between atlas and axis. Next is condylar joint. Here this is condyle of the mandible, it articulating with the mandibular fossa of the temporal bone, forming the condylar type of temporomandibular joints. It is one example of condylar joint. So the round articular surface of one bone feeds into the socket type articular surface of another bone, and the end of the bone bearing rounded articular surface is called condyle. This is condyle of the mandible, and these joints permit movement in two directions. Okay. Examples are right and left temporomandibular joints and knee joints. Condyles of knee joint, condyles of the tibia and condyles of the femurs are articulating. Next is ellipsoid joint. Elliptical convex surface of one bone. See here, this is elliptical convex surface of one bone articulates with elliptical concave surface of another bone, and the movements are permitted in two directions. Examples are the wrist joint, atlanto-occipital joint, metacarpophalangeal joints and metatarsophalangeal joints. These are examples of this ellipsoid joint. Next we go to the saddle joint. Saddle joint, the articular surface are reciprocally saddle separate, that is concavo-convex. Here you can see concavo-convex, and other bone surfaces reciprocate with others. Okay. So this unique articulation is modified condylar joint, and that allows a wide range of movement. Example would be the joint between the trapezium and first metacarpal bone of the thumb. Another is sternoclavicular joint. There also saddle joint is present. Next is ball and socket type of joint. Ball and socket type of joint consists of a bone with a ball shaped head. Here, this hip joint occurring between the head of the femur and the acetabular cavity, forming the socket. Okay. This is one example of ball and socket joint. And superior extremity The articulation between humerus and glenoid cavity is ball and socket type of joint, that is shoulder joint. Okay. So this type of joint allows a wide range of movement than any other kind. Okay, and it permits movement in all the planes, and a rotational movement occurs around a central axis. It consists of a bone with a ball-shaped head that attaches with a cup-shaped cavity of the another bone. Two examples of this type of joint would be the hip joint, shoulder joint, and third number is incudostapedial joint between the incus and stapes. Okay, three small bones are present within our middle ear, malleus, incus, and stapes. In between the incus and stapes, incudostapedial joint is also ball and socket type of joint. Okay. Examples are important for your MCQs and Viva. Okay. And if long question comes, you have to write down all those. Now, classification according to the number of the articulating bone. Three types of synovial joints are present. That was structural classification of the synovial joints, 7 types. Okay. Now, this is according to the number of the articulating bones. Synovial joints are of 3 types. Simple joint, 2 articulating surfaces are taking part. Examples are shoulder joint and hip joint. Then compound joint, 3 or more articulating surfaces are present. Examples is radiocarpal joint. Complex joint, 3 or more articulation surfaces and an articular disc or meniscus is present. Example is the knee joint. Okay. See here, this is simple type of joint, 2 articular surfaces, 1 synovial cavity. Here this is compound type of joint, 3 bones are taking part. Okay. At the in this elbow joint, see lower end of humerus, radius and ulna, 3 bones are taking part in formation of elbow joint. So this is a compound type of joint. Then here is the knee joint. See this projecting cartilaginous part, these are the meniscus which is dividing this synovial cavity into 2 compartments, superior and inferior compartments. So this is a complex type of synovial joint. Okay. So these are the different parts of the synovial joint: fibrous capsule, reinforcing ligament, synovial membrane, articular cartilage, articular disc, fat pad, bursa. This what is bursa? It is a flattened sacs that contain the synovial fluid and function to reduce the friction. We will discuss in details tomorrow. See, this is one bursa. Yesterday we have learned subacromial bursa. Subacromial bursa is extension of the synovial cavity from this shoulder joint. Okay, this is subacromial bursa. In between the tendon of the supraspinatus and this and it lies below this acromial process of scapula. So here is presence of one bursa, subacromial bursa. Now there is functional classification of the joint. Joints are divided into 3 parts: synarthrosis, amphiarthrosis and diarthrosis. Synarthrosis permit little or no movement, and most synarthrosis joints are fibrous joints. Examples are the cranial sutures in the adult. No movement generally occurring in between the bones. So these are example of synarthrosis. Next is amphiarthrosis. Amphiarthrosis permit slight mobility, and the 2 bone surfaces at the joint are both covered with hyaline cartilage and joined by strands of fibrocartilage. Examples are the secondary cartilaginous joints: manubriosternal joint, intervertebral joint, symphysis pubis, like this. Okay. And diarthrosis, they permit a variety of movement. Only synovial joints are diarthroidal. Okay, so movements are present in different axes. So these are the 3 types of functional classification: synarthrosis, amphiarthrosis and diarthrosis. Synarthrosis permit little or no mobility. Most synarthrosis joints are fibrous, can be categorized by how the two bones are joined together. Synchondrosis and synostosis. Synchondrosis are joints where the two bones are connected by a piece of cartilage. Synchondrosis. And synostosis are where two bones that are initially separated eventually fuse together, essentially becoming one bone. In human, the plates of cranium fuse together as a child approaches uh, adulthood. This occurs between the occipital bone and the sphenoid, basiocciput and basisphenoid, synostosis. Children whose cranium fuse too early may suffer deformities and brain damages as the skull does not expand properly. The anteroposterior length will be reduced if they fuse early, and the skull does not expand properly to accommodate the growing brain, and a condition known as craniostenosis occurs. Now, amphiarthrosis permits slight mobility. Two bone surfaces at the joints both are covered with hyaline cartilage and joined by strands of fibrocartilage. And most amphiarthrosis joints are cartilaginous, secondary cartilaginous joints mainly. Next is diarthrosis. These are the synovial joints, permits a variety of movement, flexion, adduction, pronation. Only synovial joints are diarthroidal, and they can be divided into these types. We have discussed these types. Now, biomechanical classification according to the number of bones, that is biomechanical classification. Okay. Joints can also be classified based on their anatomy and on their biomechanical properties. According to the anatomical classification, joints are subdivided into simple joint and compound joint, and depending on the number of bones involved, and into complex and combination joints. These are the biomechanical classification. So, simple joint, two articular surfaces, shoulder joint and hip joint are the examples. Compound joint, three or more articular surface. Radiocarpal joint, complex joint, three or more articular surface, and articular disc or meniscus is present. Knee joint. Now, anatomical classification, joints may be classified anatomically into these following groups according to the region. These classifications are according to the region, like articulations of the hand, wrist, elbow, axillary articulations, sternoclavicular joint, vertebral articulation, temporomandibular joint, sacroiliac joint, hip joint, knee joint, articulation of the foot, according to the different regions of our body. Okay, now these are the different movements of the joint. So, classification, you remember very carefully the structural and functional classification. These two are very, very important. Mainly the structural classification very frequently asked. Okay, structural classification and functional is important. Rest you just know, don't need to remember that much. Next, the terms related to the joint movement. There is extension. What is extension means? Extension means increasing the angle. Keep it. Huh? Okay, okay, you can go. Extension means increasing the angle. In the anatomical position, everything is extended. Okay, so anatomical position will be like this. So every joints are mainly extended in position in anatomically. And what is hyperextension? To increase the angle beyond the anatomical position is hyperextension. These two are lying in same line. This is extension. If you extend more posteriorly, so that will be hyperextension. Next is flexion, decreasing the angle. This movement is the flexion. And plantar flexion, to point the toe. Plantar flexion occurs in foot. Okay, foot goes downward towards the plantar aspect. Dorsiflexion pulls the toes up. The foot plate is pulled upward. That is dorsiflexion. abduction, movement of a limb away from the trunk of the body. So this will be the abduction of the shoulder joint. Now adduction, moving a limb towards the trunk of the body. This movement will be the adduction of the shoulder joint. Next is rotation, movement of a bone around a axis. Okay, so this is the rotation movement. Okay, so rotation, and then circumduction, circular movement of the distal end of the limb. Mainly part of this rotation. Supination, palm in the anatomical position. Here, this position is supination and this is pronation. Okay. So, pronation, palm faces backward. Inversion, turning the sole of the foot inward. If sole of the foot turning inward, this is inversion. And if it faces outward, that will be the eversion, occurs in the sole. Eversion, turning the sole of the foot outward. Okay, that's all. And parts of the synovial joints we will discuss tomorrow. Now, what are the factors influencing the joint stability? The shape of the articular surfaces, the ligaments, and the muscle tone, muscle attached to the bones, all these are providing stability to a joint.